Good afternoon, everyone. Thank you for joining us. My name is Zach Seeloff. I'm a pediatric nurse in the operating room at UW Hospital's American Family Children's Hospital. And joined by all the amazing nurses behind me and all the amazing nurses in the hospital today, I want to tell you that for my nurse colleagues, for my family, and most importantly for our patients, I am going on strike. It is great to be out here with you on Labor Day, the perfect day to make this announcement to the community. I want to take a moment to thank the community, most especially SCUFFLE, the South Central Federation of Labor, who's hosting this event. Thank you very much. I want to thank all the community supporters who joined us and the elected leaders who have joined us, some of whom are going to speak with us today. On Labor Day, it's important to remember unions are not a thing of the past. Unions are how we have won hard victories to make life better for workers everywhere. They are just as relevant today as they were 100 years ago, 150 years ago, and that is why we are here today to form a union of nurses. Workers across the country are rising up. We know teachers in West Virginia and Oklahoma. We know other nurses in Minnesota and California. Municipal workers in this state here and so many others are going on strike and demanding their union rights, and we are here to do the same. UW nurses are not alone in this fight. We are joined by so many other union workers who are here to support us, so many elected officials who are here to support us, and members of the general public who know how important the work is that we do and how important it is that we have a seat at the table so we can advocate for our patients. So, with all that said, it's time to get on to the people who are here to talk about this union effort, what we can do to help, and how we can make it successful. I would like to introduce, to begin with, Representative Francesca Hong.
Good afternoon, everyone, and thank you so much for being here. I am honored to represent the 76th Assembly District here in Madison. And as a mom, a service industry worker, and a small business owner, I am proud to be pro-care work, pro-care worker, pro-union, and pro-union for nurses. UW Health nurses have been a part of my entire life, from mental health care to reproductive health care. They were probably one of the first people to hold my son after he was born. It's the UW Health nurses who are trusted adults in my son's life and one of the first people really to enter his life and make a difference. Right now, we are in an era that demands movements and resistance. We must center dignity, respect, and care for working people to benefit the lives of all. It is past time to take a stand for labor rights, not only because our conscience demands it, but because the future of Wisconsin relies on it. As policymakers and legislators, our commitment to the working class cannot end at some boilerplate support for rolling back Act 10. We must also find new ways to build coalitions, bring everyone along in this movement by reaching out to voters, educating the public, and making strong and principled arguments for labor and labor protections. We need a cultural reset, to be honest, here in Wisconsin. We need to make sure that none of our nurses or our working class have to make the hard decision between their health and their job. They should not have to check their rights at the working door. The well-being of our workers is the well-being of our children, our state, and our democracy. Today marks a renewal for the fight for what's right, and again, I am honored to be here with all of you. Thank you.
Thank you so much, Representative Hong. Next up, we have a UW nurse to tell us why she's going on strike, Sherry Signer.
Good afternoon, everyone. My name is Sherry Signer, and I currently work in the infusion center at UW. I've worked at UW for 19 years, and 15 of those years has been as a nurse. I am proud of what I do, and for most of my career, I have been proud of where I work. I remember the days when we had a union contract and when our hospital put people before profits. But things have changed since that contract expired in 2014. I remember the moment when I couldn't bear those changes any longer. The administration decided to disband our SOS nurse team. For those who may not know, our SOS nurses are our rescue nurses who swoop in when a patient is having a cold blue or is rapidly declining. They literally help save lives in the hospital. This was a huge loss and it was scary. I was so frustrated that I sat down and I wrote out 40 things, a list of everything that we had lost since our union disappeared. They were changes like cuts to staffing ratios and benefits. One of the changes was cuts to nurse training hours. We used to allow nurse residents time to take on patients slowly as they became more comfortable. New nurses would start with one patient and then maybe a week later move up to caring for 2. They had time to learn and there were enough nurses to train new folks. Now our new nurses are thrown in with a full load, and if they need help, odds are they have no one to turn to other than another new nurse, because so many experienced nurses have left UW. This is not right. It's not right for new nurses. It's not right for experienced nurses. Most importantly, it is not right for our patients. As nurses, we don't like to be vulnerable. We want to be strong for our patients and for one another. We are highly trained, skilled professionals, and we have been reduced to begging for help. That is no way to run a hospital. That's no way to run a healthcare system. I have a message for the hospital administration and the board. Shame on you. Shame on you for allowing it to get to this point. Shame on you for dumping money into buildings instead of patient care. Shame on you for turning business of caring for people into just a business of profits. And to the UW board, we have reached out to you over and over and over, and every time you turn us away. All we want to do is talk, and you won't even give us that dignity. To CEO Alan Kaplan, as a doctor, you should know about quality care, but you haven't taken care of your staff, and that means you aren't taking care of your patients. I've worked at UW through the tenure of 4 CEOs. I will never, ever stop fighting for my union, and I will never stop fighting for my colleagues. I am not okay with average care, and I don't want to be in the 50th percentile compared to other hospitals. I want the best patient outcomes, not average ones. How do we do that? Together. I want UW to be a leader again. Our patients deserve it, and if I have to walk off the job to demand better for them, I'll do it. We're willing to do what it takes because that's what our patients deserve. Recognize our union now.
Thank you so much, Sherry. Next up, we have the president of SEIU Healthcare Wisconsin, who has been so instrumental in this effort, Pat Rays. Pat.
Hello, as Zach said, I'm president of SEIU Healthcare Wisconsin, the largest healthcare union in the state, but I am also a nurse. I have been a nurse for 33 years at Meriter Hospital, and I am so proud of all of these nurses behind me, making groundbreaking decisions, not because SEIU represents thousands of nurses and healthcare workers, and we're all locked arm in arm together with the UW nurses in their fight to win a union, the recognition to ensure safe, quality, compassionate care for our patients. Some of you may think that the UW nurses are fighting for a union is only about a voice, better wages, and better benefits. That's not the case. More importantly, nurses advocate daily, hourly, and every minute for our patients. And forming a union gives us the right to advocate better. Unions are a key factor in keeping healthcare workers and their patients healthy. A recent study found that nursing homes with union workers had lower COVID rates and lower worker rates of COVID. Acute care hospitals with unions have higher nurse-to-patient ratios, which has a high correlation to reduce the morbidity and the mortality of our patients than non-union hospitals. Unions protect patients and workers alike, and that is the union difference. Across the country, workers are exercising the power like we have never seen before. They're demanding the rights to form unions, insisting on a voice in their workplace and in the democracy. 15,000 nurses in Milwaukee are going on strike September 12th. This strike-tember, nurses across the Midwest are rising up to demand respect, protection, and the right to join a union. The members of SEIU Healthcare Wisconsin will not walk across the picket lines. We have the backs of the UW nurses, and we invite everyone to join in solidarity with these courageous nurses fighting for patient care. Thank you.
All right. Thank you so much, Pat Reyes of SEIU Healthcare Wisconsin. We now have Dane County Supervisor Mike Baer. Mike, come on up.
Well, thank you everyone for having this today, and it's unfortunate that you do have to have it. Workers have rights. Workers ought to be able to exercise those rights, be part of a movement, and I'm honored and privileged to be here, be part of that movement today. Thank you all for being here. Thank you for the invitation. When nurses came to us on the county board earlier this year and said, we're having trouble, we're struggling, we need your help, I said yes. Brought a number of colleagues along with me, and a number of them here today who have been leaders on this issue. Majority of the county board stands with UW Health nurses, and will be standing with you throughout this strike and throughout this time and trying to get you the rights that you have so definitely earned. We have put together a subcommittee that I was proud to lead along with Supervisor Hulsum and Supervisor Hatcher to look at these issues, and we learned a lot about the struggles and the nightmare that nurses and healthcare workers have been through these last 2 years, and even going back farther than just these past 2 years. We must invest in these workers. We have to give them the things that they need to be successful. We have to take care of their mental health, take care of their trauma. And if we don't, we are all in trouble. We rely on these workers to take care of us when we're sick. I've relied on UW Health nurses to take care of my mom when she was struggling with a terminal illness. My son when he's been in the pediatric ICU twice. They show up for us. We have to show up for them. That's why I'm proud to stand up here for them today. So thank you all for the movement, for the work that you're doing. Proud to stand with you. Keep up that fight. We'll be there with you. The county board is in support, and help us help you. Let us know what you need. We will be there for you. Thank you so much.
Thank you, Supervisor Baer. Next, we have a UW nurse from the hospital formerly known as TAC, Jack Trudell. Come on out, Jack.
Okay, well, my name is Jack Trudell. I've been a nurse for 28 years. I've worked at UW Hospital for the last 18. I've worked in critical care, I've worked in procedures, and I presently actually work out at the newly christened East Madison Hospital in the recovery room over there. Newly rechristened, I guess, because in the time of crisis that we're in, Dr. Kaplan and the board decided to spend tens of thousands of dollars to change the name of a building. I was also a nurse during Act 10, and I was there on that terrible day in 2014 when we lost our union. And I can tell you that, things weren't perfect, but we had language on staffing ratios. We had a grievance procedure. We could actually redress it. So if somebody stood up and said, this isn't safe, or I don't feel safe doing this, they got to respond. They had to respond to that. If they didn't, we brought the full force of our grievance procedure down and our union contract down. And I will say, as a nurse with my experience, and I think every nurse can say the same, I've been really scared at work, but I knew what to do in those situations. And I will tell you, the scariest feeling I've ever had was when I had to walk back into the hospital in 2014 without that union protection. And I think it turns out that I was right to be scared. Just some examples of the American Center, the hospital over there. What we've gone through there is that, we're a closed unit, so we don't get float staff or support staff. So we actually spent much of the last year, both pre and post-pandemic, as they tried to crank through as many surgeries as possible, being mandated to stay for up to 3 hours after the end of our shift. When they ran out of nurses on the floor, or they ran out of beds on the floor, they told us in the recovery room that our new job was that we would be forced to stay overnight with patients, warehousing them in unsafe conditions in the recovery room, something that still is happening to this day. When they talk about shared governance, and they talk about how they can work with us, it took them actually a year of that, of every day us going in and the call team worrying that they might have to stay overnight with patients in that situation. And we are not inpatient nurses, we're recovery room nurses. But to them, a nurse is a nurse is a nurse, and so they feel free to do with us whatever they want. It took them a year to even agree to actually to offer bonuses for people to stay overnight instead of just forcing the call team to come in and do it. That's their idea of shared governance, and that's why we say, when Dr. Kaplan points to that is not enough, that we need a real independent voice. I know one of our previous speakers spoke about the critical role that SOS plays. I was actually on the code team 15 years ago when I was in cardiac critical care. And just last year, as they had a shortage, they didn't have anybody to cover SOS for that entire hospital, and oftentimes that's true. Beware. So they called the three of us that were going to be on call over that weekend in and told us that we were also going to be on call for SOS. So if an ICU patient suddenly appeared, we would be called in to take care of those patients. Two of those people actually had no critical care experience, and like I said, I hadn't had it for over a decade. And they told us this on Friday afternoon at 3 o'clock, and it was to begin at 7 o'clock. And when we told our manager, this is ridiculous, we don't feel safe doing this, we actually convinced her of that. And then she went to her administrator, who, presumably said something. We kind of thought we were off the hook. She came back and said, nope, sorry, you still have to do it. That's the kind of way that I think they think of nurses, and frankly they think of patients at UW Hospital, that they own us, and they do not own us. So I said with, I grew up here, I'm used to these colors, I'm a former Madison East Bird holder. I have to get over it a little bit because of the whole Viking thing, but we can do this. And I think the last thing I just want to say is, I don't know where Dr. Kaplan grew up or hatched out of. But, sorry, that was cheap. But I do know where I grew up, and I do know the connection between the nurses at that hospital and the people of this town. And so I would reach out to say, we are willing to stand up, and partially that's because we know that you will stand with us. We know that you know that the best place we can be to fight for patients, to fight for you, to fight for our community is out on that picket line, and if you believe those things, you need to be out there with us. My hope is that he realizes that, he kind of bit off more than he can chew, and that he comes to his senses and comes to the table so we can actually move forward and talk about how we build a better healthcare system in this town and in this country. But until he does that, we will be out there for this strike, and we will be out there defending you during this strike. So thank you very much.
Thank you so much, Jack. As we get things rearranged here, I want to ask all the wonderful nurses behind me, we're going to show physical solidarity with each other and tighten up a little bit because we have a lot of people that want to get involved, move together. Next up, we have State Representative Diane Hesselbein. Thank you so much, Diane.
Happy Labor Day. It is an honor to be here with these wonderful people today. Thank you so much for inviting me. Years ago, in 2012, I wrote a resolution for everybody in Dane County to vote on, and it went something like this. Should all Wisconsin workers be able to seek fair pay and safe working conditions through collective bargaining? That was in 2012 on the April ballot. Around 70% of the people who voted in April of 2012 said yes. When we asked our community, do you believe in collective bargaining? They said yes. And what did that do? Well, it certainly sent a message to Republican Governor Scott Walker and his cronies that Dane County will continue to stand with workers. And what I would encourage this UW board and the powers that be is to take a look at that 2012 election and how people showed up to support collective bargaining, because it works. I was fortunate to be on the chair of the Personnel and Finance Committee for the county, and I tell you what, we heard more stories from workers, from AFSCME to SEIU to the deputies, not just about their own safety, but the safety of the residents that work and that deliver those services. People at Badger Prairie that needed help. Things that weren't safe that we could fix. And we did. So to the powers that be, collective bargaining works. It works for the worker and it works for the people that are getting those services. I highly encourage them to get on board with that. On a personal level, my mom slipped and fell about 3 weeks ago, and she's rehabbing at a facility. And it is hard. It's hard. She's working hard to get better. But one thing I don't have to worry about is the nurses in that facility are unionized. And I know they're not just looking out for their safety, but my mother's safety as well. So we're all in it to win it. I'm on your side. I will show up to that picket line. Let me know what we can all do to help. Thank you for being here today, and we're going to win this one. Thank you.
Thank you, Representative Hesselbein. Now we have Madison Alder Tag Evers. Tag?
Hey everybody, welcome to District 13. I'm the alder for District 13 and the Labor Temple is in District 13. Welcome to this very momentous event, very powerful gathering here. Just a quick personal story. 9 months ago, after one of the first winter snowfalls, I slipped on the ice and broke my ankle, requiring surgery. I received great care at UW Hospital, not just because I wore this mask. I received great care because that is what these nurses have dedicated their lives to helping others in their time of need. Now, yesterday in church, the sermon was on work, a good Labor Day weekend sermon, with the text from Exodus in which God speaks to Moses from the burning bush and gives him a task to set his people free from Pharaoh's oppression. The message of the sermon about finding faith in the world of work was that it wasn't just the leaders in the headlines, it was those on the front lines who make a difference. And one of the deacons in the church, who happens to be a nurse at UW Health, had shared with the pastor about her work. She said this, which the pastor then quoted in her sermon. My work as an RN and as a patient advocate in the UW health system can be frustrating, intimidating, oppressive, and traumatic, as a professional voice is not valued, respected, or acted upon. Experienced nurses are torched by the employer to the point of burnout, leaving the bedside profession, replaced by nurse residents that are overwhelmed by the increased lean staffing ratios, leading to a more unstable patient population. Now, the face of UW Health has long been one of quality care, but sadly the face of UW Health is in grave danger of becoming the face of frustration, the face of intimidation, the face of oppression, and in so doing creating trauma in the place of empathy, creating instability in the place of stability and a healthy and safe patient population. I'm friends with a couple of doctors at UW, and they're ashamed of this administration. It's time for this embarrassment to end. UW Health must yield to the fair and just demands of the nurses who toil on the front lines and work for the health and safety of their patients. One last thing, I have a dear friend, Sarah, who is a UW nurse. She loves being a nurse, but the stress of it lately has been overwhelming. She supports the strike, of course, but is fearful of losing her job. Today, we stand with Sarah and all her fellow nurses in solidarity, warning UW Health that retaliation against our nurses will not be tolerated. I am proud to stand in solidarity with Sarah and her fellow UW nurses. Solidarity.
Thank you so much, Alderman Evers. And now we have from Madison, Representative Mark Pocan.
Well, it is great to be with everyone here on Labor Day, and what a perfect day to say thank you to all the amazing nurses at UW Health. Let's thank those nurses. For the last 2.5 years, our nursing personnel at UW Health and other facilities have taken care of us during what I think is probably the most challenging 2.5 years most of us have had in our lifetime with COVID-19. And it is so appreciated, the work that they've done. I come here as one of the chairs of the Labor Caucus in Congress and as a 3-decade-long member of the International Union of Painters and Allied Trades. My brothers and sisters in the union appreciate that. Thank you. I can tell you from this experience, there is no question that when workers have a voice in their workplace, you will have better outcomes no matter what the job is. And in this case, there's nothing more important than someone who works day to day with people in hospitals and clinics, who knows what's best for those patients and their care, to have a say in their workplace, in their working conditions, in the safety conditions, and in their pay and their benefits. And that's why it's so important that the UW Health Board listen to this message very clearly today. You have a world-class organization, a world-class institution in the UW Hospital. And you have that because you have world-class employees and nurses at UW Health. You now need to put on your big boy and big girl pants and decide to make a world-class decision. Respect your workers and recognize this union. There doesn't have to be a strike. The board can simply follow the advice of Attorney General Josh Kaul and recognize this union and do the right thing. But if they don't, I think everybody around us and hundreds times the number of people here will support every single healthcare professional and nurse at UW Health when they do have to strike, because the best interest of this community is to have the best healthcare workers with the best working conditions at the best facility, and they can make that decision. UW Health Board, recognize this union.
Thank you very much, Representative Pocan. And now, as is appropriate for our final speaker, it is UW nurse Mary Jorgensen. Mary, come on up.
Hi everyone, my name is Mary Jorgensen. I have been a nurse in the inpatient operating room for 17 years, and I've been a nurse for 25. I first off want to thank all your speakers, Representative Hahn, Representative Hasselbein, Supervisor Baer, Alder Evers, and Congressman Mark Pocan. And thank you to my nursing colleagues for speaking today. Zach, Pat, Sherry, and Zach, and Jack. Sorry, Jack. We have been fighting for our union for 3 years. Our patients need us to fight for them because this administration will not. We are here because we want quality patient care, we want respect, and we want recognition of our union. This strike is about taking care of patients, but we aren't given the tools to do that job. Administration has cut staffing, taken away proper training. We are exhausted, making us prone to mistakes. Patients deserve better. I am encouraged by all the love and support we have gotten from our community, our fellow unions, elected officials, and the governor. We've heard solidarity messages from across the country and from patients here in Madison whose lives we've touched. But at work, it's a whole completely different story. We are not treated with respect. We are being intimidated and harassed, especially in these past few weeks. We need the administration to stop hiding behind Act 10. The Attorney General has given you the green light to recognize our union. There is nothing that prevents UW Health from recognizing us except themselves. We have been fighting this fight for 3 years. It's time for them to come to the table with us. Nurses are not good at asking for help, but that's what I'm asking for, and we shouldn't have to ask for help. To the community, come out, show up. We need your support. Please come to our rally at 4:30 on the first day of our strike, September 13th, at the First Unitarian Society, 900 University Bay Drive. If you can't come to the rally, please join us on the picket line, even if it's just for a little bit amount of time. We will be out of work from 7 a.m. on September 13th to 7 a.m. on September 16th. We will be there fighting for patients and for ourselves and for the entire community. Solidarity forever.
First, let me say thank you to all of our speakers. Let's have a big hand for everyone who came out to speak today. Thank you so much. I want to close as we finish out here with a quote that I've used for a long time. It was from George Carlin, of all people. He ended the special by saying, "Take care of yourselves and take care of somebody else." The nurses you see behind me are having a harder and harder time taking care of themselves because of how much work they do to take care of the people in our community. So on their behalf, I want to implore all of you who are here, all of you who are in our community, all of you who rely on UW Health to care for you and your friends and loved ones, to lend us a hand in this effort. Take care of your friends and neighbors, take care of the people in your community, and take care of the nurses who are there for you when you need care. Join us on the picket line. Join us in solidarity on the internet, and we will win. Thank you very much. Thank you so much for coming. If anyone has any questions, we have a lot of nurses here who can give you answers.
Do we have any questions from the front? You guys want to take one-on-one? So, for folks that are here, we're going to do a picture with the electeds in the picture, and then we'll have the electeds give it just you guys.
Gotcha.
You're going to need to create a little room here. One person.
News 3 Now is always on.
Get the Channel 3000 app, activate the push alerts, and we will send you breaking news, traffic, and weather alerts as it happens.
The Channel 3000 app. Get it now.
Powered by News 3 Now.